The last thing I want to talk to you about is the treatment of patients with hypertension. That is, we can treat hypertension with drugs. And we do treat hypertension with drugs, and billions of pounds later, and millions of healthy, happy customers, patients later, we can safely say that drug treatment, when it comes to hypertension, is extremely successful and extremely effective. Having said that, you don't treat everyone with drugs. I mean, you don't treat a gentleman of 86 with a blood pressure of 180 over 110, even though he's theoretically hypertensive. Because you have good sense, good common sense, which will tell you that it's the normal process of getting old, the normal part of aging, that your blood pressure goes up. Because you have atherosclerosis vessels, and therefore the resistance to blood flow from the heart is going to increase. So the heart has to increase its perfusion pressure, and the blood pressure goes up and up. And you know that these drugs are not like sweeties. They have side effects, serious side effects, and therefore they're not well worth taking. If you have a young patient who's 25 with a diastolic blood pressure of 105 and is symptomatic, and you can't find the cause for their hypertension, you treat them. Because you know they have 65 or 60 years to live, and you don't want them to have a heart attack, or you don't want them to have a stroke. You want them to fall in love, get married, have kids, and enjoy their good life. And even though that these drugs have side effects, they're well worth taking because of the likelihood that they may do some good. You need not know all about these drugs. I'm going to give you a list, and I'm going to go through them. It is the technique that is the most important thing to consider. And the technique is to decide whom you're going to treat. And then after that, be very sensible about it. And see if we can get by just using one drug. But then come back and appreciate and realize that patients may not respond to one drug. And you may need to use 2 drugs, and on occasion, 3 drugs. The drugs themselves, well, before I talk to you about drug treatment with patients with hypertension, with a high blood pressure, I think it's important for me to talk to you about non-drug treatment first. Because if I told you that obesity was a risk factor, and drinking too much booze, and smoking too many fags, and having too much salt, and not enough exercise, and eating too much red meat were all risk factors, it would be sensible to correct these before you put patients on drugs which would poison them. So you will slim down your hypertensive patient. You tell them not to go boozing, you tell them not to go smoking, you tell them to cut down the amount of salt in their diet, you tell them to have more fish and more exercise and cut down the amount of red meat they consume. And if you can get by just giving them good, sensible advice, that is great for you and is even better for your patients. But patients are funny. People are funny. They might not listen to your advice. And you say to yourself, even though my patient is funny, I'm still going to give them therapy. I'm still going to give them treatment. And the kind of drugs that you would consider using, well, you could use a diuretic drug. You recall me talking to you about diuretics when I was talking to you about treatment of patients with heart failure. And I told you that the sheet anchor of treatment in patients with heart failure was the use of diuretic drugs. Drugs that make you pass more sodium and therefore more water. So you get rid of the edema, you get rid of the congestion, the venous pressure falls, the fluid in the body cavity disappears, and the heart can resume her activity in some normality. And chlorothiazide, given by oral agents, were extremely effective. But how would a diuretic drug work in patients with hypertension? Well, it would dehydrate them a little and reduce the blood volume. That certainly would have an effect, but diuretics do more than that. Diuretics stabilize small blood vessels and prevent them from going into further spasm. So they have an effect other than volume depletion. And they're given on their own, and they're very effective on their own. The second sort of drug that you may consider using are the beta adrenal receptor blockers, the so-called beta blockers, drugs such as isoprolol, very popular, and they're given on their own, and I talked to you about them previously. I said to you that beta blockers essentially stop the heart from accelerating and reduce the cardiac output. Blood pressure is a combination of cardiac output and peripheral resistance. So if you can lower the cardiac output, you will lower the blood pressure. And isoprolol and drugs, generic name, other generic drugs, are given on their own and very effective on their own. The third group of drug you may consider using are the vasodilators. Drugs such as nifedipine, calcium channel blockers, and you recall I talked to you about that when I was talking to you about angina. And if you give a patient who is hypertensive with a high blood pressure, calcium channel blockers, that certainly would reduce the blood pressure. The fourth group of drug you may consider using is the angiotensin converting enzyme inhibitors, the ACE inhibitors, drugs such as ramipril. If you recall, angiotensin converting enzyme converts angiotensin 1, which is ineffective, into angiotensin 2, which puts your blood pressure up, and that switches on aldosterone. If you can inhibit it, you prevent blood vessels from going into spasm and constriction, and therefore the blood pressure falls. So there are 4 groups of drugs that you may consider using, starting with the simplest, the diuretic and the chlorothiazide, and ending up with the most complicated, the ramipril and the angiotensin converting enzyme inhibitors. The idea is that you use a very simple approach and try and see if you can get by just using one drug, but then coming back and realizing that patients will not respond to one drug. And you may need to use 2 drugs, and even on occasion 3 drugs. And finally, realizing that if you give patients 3 drugs to be taken 2 or 3 times a day, on top of what they're taking for their other illnesses, they may not take them. So there's always going to be a question with what we call compliance. Thank you very much for listening, and I hope it's been